Hey guys, please subscribe to our channel and press the bell icon for more updates, and also like our videos and share them.
What are the treatments of acne? The occasional pimple can be concealed if used at all. Over-the-counter cover-up creams and cosmetics should be water-based. Even if outbreaks of acne cannot be eliminated, conventional treatment can provide relief. The best treatments inhibit sebum production, limit bacterial growth, or encourage shedding of skin cells to unclog pores. Because many therapies can have side effects, any patient with acne should proceed with caution when trying a new treatment. People with any type of acne that lowers their self-esteem or makes them unhappy, those with acne that is leaving scars, or people with severe persistent cases of acne need the care of dermatologists. Non-prescription treatment for acne. Number 1 is soap and water. Gentle cleansing of the face with soap and water no more than 2 times a day can help with acne. However, this does not clear up the acne that is already present. Aggressive scrubbing can injure the skin and cause other skin problems. Number 2 is cleansers. There are many cleansers and soap advertised for treating acne. They often contain benzoyl peroxide, glycolic acid, salicylic acid, or sulfur. Benzoyl peroxide for mild acne. You may try, or your doctor may recommend treatment with a non-prescription drug that contains benzoyl peroxide. It's believed that this compound works with destroying the bacteria associated with acne. It usually takes at least 4 weeks to work, and it must be used continuously to keep acne at bay. Like many over-the-counter and prescription products, it does not affect sebum production or the way the skin follicle cells are shed, and when you stop using it, the acne comes back. It is available in many forms: creams, lotion, cleansing pads, or gel. Benzoyl peroxide can cause dry skin and can bleach fabrics, so take care when applying it. Consider wearing an old t-shirt to bed if you are applying it to your back or chest overnight. Salicylic acid. On the skin, salicylic acid helps to create the abnormal shedding of cells for milder acne. Salicylic acid helps unclog pores to resolve and prevent lesions. It does not have any effect on sebum production and does not kill bacteria. It must be used continuously, just like benzoyl peroxide, because it affects stop when you stop using it. Pores clog up again and the acne returns. Salicylic acid is available in many acne products, including lotions, creams, and pads. The next one is sulfur. In combination with other substances such as alcohol and salicylic acid, sulfur is a component of many over-the-counter acne medications. It usually is not used by itself because of its unpleasant odor. It's unclear how sulfur works, but it has only a marginal benefits in most cases. Topical retinol gel. Retinol gel works to keep pimples from being able to form. It affects the growth of cells, causing increased cell turnover to unlock pores. Your acne may appear to get worse before it gets better, because it will work on the pimples that have already started forming beneath your skin. It must be used continuously and may take 8 to 12 weeks to get results. Retinol used to be available in only a prescription strength. Different gel is the only topical retinol approved as an over-the-counter treatment for acne. The next one is alcohol and acetone. Alcohol is a mild antibacterial agent, and acetone can remove oil from the surface of skin. These substances are combined in some over-the-counter acne drugs. These agents dry out the skin, have little or no effect on acne, and are generally not recommended by dermatologists. The next one is herbal, organic, and natural medication. There are many herbal, organic, and natural products marked to treat or prevent acne. The effectiveness of these agents is not proven and they are unlikely to have much benefits. Note: when pus-filled pimples are ready to break, apply a hot towel for a few minutes to encourage the natural bursting process. Inflamed pimple should be opened only by a nurse or a doctor using surgical instrument and following antiseptic practices. Squeezing pimples yourself may lead to further inflammation and perhaps permanent scars. Thanks for watching.